Morning. Welcome to the Candoa County Health and Human Services meeting and all our guests here. Good to see you all. On our agenda this morning, the first order of business is to approve the minutes from the March 1st meeting.
Also move.
Commissioner Nissen moves. Do I hear a second?
I'll second that.
Commissioner Anderson seconds. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. We also need approval of the bills.
Also move.
Commissioner Gardner moves on the bills.
And I will second.
Mr. Berg seconds. Any discussion? By the way, those are available upon request if anybody wants to take a look at them. Hearing no discussion or questions, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. And we had 3 warrants to cancel. I would entertain a motion for canceling the warrants.
I'll go ahead and move
Commissioner
that.
Nissen moves.
I'll second.
Okay. Commissioner Gardner seconds. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. That too carries. So, Jenny Lippert is going to present on some staffing, proposed staffing changes. Good morning.
Good morning, Jenny.
Good morning. Thank you for having me. All right, so today I want to talk to you all about the need for some structural staffing changes to Health and Human Services. So Candoa County Health and Human Services, we provide a full range of services to our community. We provide services to individuals that come from all ages and all walks of life. We provide them with information. We give referrals out to providers and to services that might be needed for folks in our community. Our agency is responsible for administering over 70 state and federal programs, sub-programs, and service areas. And we have 151 staff when we're fully staffed and an annual budget of $22 million. So how our agency is made up currently, we have 11 units, each ranging from 6 to 18 staff, with an average of 13 staff per supervisor. Statistics show that the average typical managerial span for a supervisor is anywhere between 8 to 10 on the high end. So as you can see, we have many supervisors that are supervising well over that threshold that they recommend for being able to adequately supervise and manage an area. Our direct staff numbers, they've increased over the years. However, we have not increased any supervisory positions. As you can see from our annual budget here, we have 46% of our human services budget is made up of staff salaries and fringe benefits. From that, we have 9.9% that goes to management personnel. So again, that's our supervisors and then half of my salary. And then our total operational expenses is 44.1%. So we're very lean, as you can tell by this breakdown on where we have our dollars spent in management staff. So our direct staff numbers, they've increased over the years. However, we haven't added any supervisory positions. So back in 2013, our agency had 120 staff. So we've added 31 additional staff members, or in terms that would be a 20% increase. But again, we have not added any management or supervisory staff to this equation. Child protection in Candoa County continues to be the fastest growing area of our agency. I presented to all of you back in July, and we're continuing to see that steady increase in the number of child protection reports coming into our agency and the number of families that are coming into contact with child protection services. Between our 2 child protection areas, Our 2 supervisors are overseeing 17 and 18 direct reports, along with trying to keep up with the fast-changing rules, regulations, and that also goes into child protection being a high turnover area for staff. It's a very hard role to keep here in any county. That's not unique to Candoa High County. Child protection in any county is very challenging. It's difficult work. It's high stress. Generally speaking, there's high demands of courts. We're also seeing increasing demands in state and federal regulations, new regulations coming that we have to abide by, along with increasing federal and state reporting measures that we have to be on top of. And I will remind you that child protection is our highest expense in our human services budget for the county. So I wanted to point this slide out. I had this included in the presentation that I gave back in July with the sheriff's office, our county attorney's office, and corrections. But Health and Human Services, and specifically child protection, has many other connections to other county departments that we work with. So again, the work that our agency does in child protection can either have a positive or sometimes a negative impact on those other departments within the county. So we know that by adding any positions, it would be an upfront investment. However, a significant cost savings benefit can be found in other counties that have done some structural changes and implemented a similar model, which I will present to you shortly. So the increase in the financial management with an added layer of support that our agency would be able to have, we would better be able to manage our financial gains and risks. We would have the ability to do some deeper dives and analysis of our financial areas to assure that our revenue is adequately being recaptured or recouped. Additional staff and management would allow us to take time to look at ways that we could reduce some of our expenses. These positions would also give us the ability to review and analyze trends and look at different areas of our services that we provide. Staff engagement, the added positions would set expectations and follow through on retaining and attracting feedback from staff directly. We would be able to have more support in budgeting areas and contract oversight and contract management. And then the biggest is the new programming and services that come to us from the state. Again, our agency would be able to look at the possibility of, making some changes, looking at different ways that we could reorganize how we're currently doing things to streamline the work that we do. So change, it takes time. However, I will tell you in my time being the Director of Health and Human Services, I have spent hours and hours looking at ways that we could leverage the agency to better set us up for success. I have worked with other counties and seen how other counties have structured themselves and made some changes as they're growing. And I've had a lot of conversations with Administrator Kleindl about different ideas. And today, what I have presented for you in your Dropbox is something that has come up in the last couple weeks due to a recent resignation that we received in the agency. Our ongoing child protection supervisor put in resignation last week. This position has been very hard to fill, and it's been very hard to keep a stable person in this position. I think that is due to the number of staff that this position has to oversee. You can't feasibly directly support 18 staff along with keeping up with the courts and maintaining communication with our providers and stay on top of all the state and federal regulations that come to our agency specific to child protection. So with that being said, if you can open up either your Dropboxes or there's printed organizational charts for you, I will walk you through what I am proposing for you today. So currently our agency is set up with myself and then 12 direct line supervisors underneath myself as the director. What I am proposing is that with the recent resignation of our ongoing child protection supervisor, I would like to see the agency go ahead and refill that open position, along with adding a third supervisor to the child protection team. Adding that third supervisor, we would include children's mental health under that area of child protection, and that would be classified as children's services for Candoa County. And with 3 supervisors overseeing children's services, I would also propose that we add an additional management staff above the 3 supervisors. That staff would act like a middle manager, would be able to assist the 3 supervisors in dealing with contract negotiations, dealing with the high demands of the courts, and working with our local judges. They would be in contact and to stay on top of the state and federal regulations and changes. Again, the state is very good at making these changes, but not providing any insight or guidance to the agency. So we often are getting something on a Wednesday afternoon that really should be implemented by Wednesday at 5 p.m. I mean, it's very quick turnarounds. And again, between our 2 supervisors overseeing over 30 staff of this area, we can't feasibly stay on top of all of that. So that additional manager would be able to assist the supervisors to take some of that off of their plate. And really our 3 supervisors would then be boots on the ground, hand in hand with our staff, providing that support and guidance on all of the cases that we encounter here in Candoa County Child Protection. I really feel confident that this type of a model is the needed change that our agency has to go with in order to maintain some stability of our child protection unit. Again, we've been through now 3 different supervisors in a short amount of time. Each supervisor exiting telling me that they can't feasibly do their job. Same with hearing from direct staff. It is very complicated to do your work when you can't get the support that you need from your supervisor and be able to do case consults and some of those things. And then on top of that, the larger picture of our agency not staying on top of the state and federal changes. I worry that at some point we're going to be missing something that could be very costly to the agency, and for that matter, even a liability issue. So at this time, I would present back to you. This is my proposal. I would really strongly ask if we could get 2 added positions to Health and Human Services.
Commissioner, or Administrator Candoa.
Thank you, Mr. Chair. This has been a conversation we've had since last July when we started doing our budget meetings, and I talked about the need, what we would need to do for restructuring downstairs in Health and Human Services. Prior to hiring Ms. Lippert as the director, the supervisors had come to me and talked about the need to have additional resources. And I told them at the time we would need to wait until we had a director in place, they get reestablished. And to keep my word, I'd like to propose we do this. This has been a conversation that we've had before July, but this has been a process that we've been looking at of what is the best way to do this. I can tell you from my experience, I've been an administrator now for 16 years. Prior to that, I was in child protection, and as a child protection worker and a supervisor. And I can tell you, of all the jobs I've had in my career, being in child protection is the hardest job I've ever had. It's a job that you're immediately judged on what you do. It's easy to second guess everything that's being done. You have multiple eyes looking at you from not only the families, extended families of the children. You got your peers, your supervisor, your courts, the county attorney's office, the prosecutors. Everybody's second guessing what could be done, and it's easy to see things after things take place. But it's not so easy when you're right in the mix of things. So I'll tell you, this year request doesn't come with ease heart. This is a conversation what we've had, we've looked at. And this is one area that I will go to bat and say, this is necessary. This is not a want. This is a need. In order for us to continue to protect the children of Candoa County and our staff, if we want to keep good staff, we have to support them. We say we support them. So I think this is the time we step up and say, we'll find a way to get this done. And that's what I'm asking you.
Thank you, Administrator Kendall. One moment, please. I just want to clarify something, and then I'd like to see us entertain a motion before we have the discussion, so.
Okay.
But one of the things I want to be clear on, because I want to make sure I understand the ask. So we have one current open position that would just be a refill. I shouldn't say just be a refill. It's important, but it's not, no net change. And then we'd have one child supervisor that would be in addition to what we currently have, and the administrative coordinator to supervise that group of staff. So
That is.
am I understanding that correct?
That is correct, yes. Replacing one supervisor as it stands, so no impact on the budget, because that's just a refill replacement. Adding a third supervisor, so the child protection team would have 3 direct supervisors, so adding 1 supervisor on top of adding a supervisor above the 3 supervisors. They classify it as a supervisor 2 position, but it would be viewed as like a middle manager to support children's services. And along with that, then we would move children's mental health over to that children's services area, and that would free up the mental health supervisor and lessen that load on that supervisor, along with bringing in children's mental health to child protection and encompassing that, calling that children's services. There's many reasons as to why. There's many other counties that do it this way. Child protection and children's mental health work very closely together. It makes sense for the ease and streamline of the work that we do to present it that way. And that's why I would request that third supervisor in making that bigger transition.
So I want to make sure the rest of the board understands what the request is here.
I have a question on
Okay.
that. And just, so you're adding 1 new person, or no, 2?
2, adding another supervisor
Okay.
and a supervisor above the 3 supervisors, so like a middle manager type
Okay, so
position.
the one that resigned is not one of those 2?
No.
Okay. And then what is the impact to the budget? Just because I don't suppose we anticipated that ahead of time, or did we?
We had talked about it is not budgeted, Mr. Chair, if you, I'm sorry. Okay, go ahead. So the impact of the budget, it would be, those 2 staff is about around $200,000, but $240,000 with benefits and everything else. But in looking at and doing my strategic planning, working with HR, we believe we can pay for this in several different ways in order to make this work. First of all, if you divide up the supervision of some of the child protection workers, if they have better supervision, you can help them learn how to code their time better. So that can increase, that's one area we can increase the revenue on. We also can look at other areas that we might be missing on dollars on other programs, because we'll have this other supervisor that can look at programs and other areas that we can be applying for, and making sure we're not letting dollars go down the drain. The third area is we have ARPA dollars that allows us to use it to increase for health and human services. And what I would recommend is we use that as a step down. So we'd start out this year using those funds at 100%. The following year, we'd go 75%. The following year, we'd go 50%. And by the time you get to the end of the ARPA dollars, you have the balance. We also will have some retirements coming up in the next few years, which will also lessen the salary request. And so as you get new supervisors come in, the higher supervisors with the higher salaries, they leave and the salaries come down. And that's my long-term plan to pay for this.
Okay.
And as you know, Mr. Chair, everything we work on, I don't plan for just this year. I look at what ways we can do down the road and how we can make it work. And I strongly believe with the budget and the reserves we have and the plan I just stated, we can afford this.
Thank you. Any other clarifying questions before I entertain a motion?
Yeah, I got one. So child protection, that's ordered by either the state, federal government, or the courts, right?
Correct.
And so, is this 100% on taxpayer or is it like local taxpayer? So it's county dollars that ends up paying for it. So we really don't have a choice with how this is set up. We can't drop out. It's what someone would say it's inelastic. When a court orders it or the state or federal government orders something, we just have to do it, and we got to figure out how to pay for it, whether or not we like it or not, I guess. So am I correct?
That is correct.
100%.
But I will tell you one thing, and you'll hear a future presentation too after I'm done. But one thing that, again, adding some increased upfront investment into this area, we maybe can look at trying to work with these families a little bit sooner and get them stable so we don't see as many individuals and folks coming into our agency for child protection. But yes, it is mandated by the state. We have no choice. It's 100% on tax levy dollars, and that's at every county.
Okay, thank you.
Mr. Chair. And if you can prevent out-of-home placements and keep the children and families together, not only you say those are direct county dollars, but you also help the family and stability for future generations to come.
All right, so the request is for for 2 additional staff people, one in a management level supervisory position, one an additional child protection worker supervisor 1.
That is correct.
And I would entertain a motion to that effect.
I would so move the recommendation of staff.
Commissioner Gardner moves, Commissioner,
Berg, I will
Berg
second,
seconds.
and I would like to make a comment, Mr. Chair.
yes, go ahead.
I've been part of some of these conversations about the needs and we're talking about needs. And as county commissioners, we all like to keep from adding staff and putting more money on the levy. But there could be even a case made that they need more staff than this, in addition in other areas. And after a lot of discussion, it's my understanding, and I support that at a minimum, we need to do this, and I feel comfortable moving forward. I think this is the best time to add any staff if we're going to do it, as Mr. Kleindahl mentioned, because of the ARP dollars, that we would minimize the initial impact on the levy. And I think down the road, I'm really worried about inflation and everything else. So if we're going to do something like this, this is perfect timing for it.
Thank you, Commissioner Berg. Any other comments? Commissioner Gardner?
Thank you, Mr. Chair. Let's be clear what this is really about. This is about the children who are thrown into horrible situations through no fault of their own, first and foremost. Secondly, this is about protecting our staff and the agency as a whole, and really the county as a whole. Those 2 things alone are reason enough to do this. I suspect that one can run an organization that's too lean, and I think that's unfortunately what's happened here. Haven't kept up with the realities on the ground. My dad had a saying that sometimes you can trip over dollars picking up pennies. And I'm not saying that that's what's happened here, but we don't want to be in that situation. It's not fair to the children, it's not fair to the staff, it's not fair to the taxpayer. This is a prudent investment in the health and welfare of our citizens.
Thank you, Commissioner Gardner. Anybody else? I would just add that I think it's pretty well known that through these last difficult 2 years with COVID, that the stresses put on families have increased problems at home, which lead to the need for the child protection. And it's not just Candoa County, it's all over the state of Minnesota and probably all over the country. So if hearing no other questions or comments, I will call for the vote. All in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you very much.
Thank you.
Yes.
So, you are going to introduce, I got to get back to my agenda, get my screen opened up here. Thank you for your patience. Shannon Templar.
Yes, I would like to bring up Shannon Templar, one of our public health nurses. She is going to talk about some of her work that she is doing with child protection. So again, as we see increasing needs and demands over in human services specific to child protection, we are really working hard on how we can collaborate with public health to do some upfront work with these families. And so Shannon's going to give you a little overview of the work that she's been doing, and we hope that this continues to support our families. Again, public health does a lot of prevention work, and getting in with these families early on has been proven some benefits in how we support the families that we serve on the back end in child protection. So I would like to welcome right now Shannon Templar.
Welcome. Good morning, and thank you for coming. For the record, and those who might be watching this, would you state your name and who you represent? Even
Yes.
though Ms. Lippert already did.
My name is Shannon Templar, and I'm a public health nurse here with Candoa County, and I work in family home visiting. So a little bit quick about my background is I've been a nurse for about the last 16 years. The majority of my career has been as a hospital nurse, specifically labor and delivery. So I've worked with moms and pregnant women and babies for a very long time. So joining in with family home visiting is perfect fit for me, and I'm passionate about it. A little background too, I have 3 children. My youngest, I adopted through foster care. So when it comes to child protection and that whole of everything it entails, I've been through that before. And I do really feel that my son's birth parents would have truly benefited from family home visiting if that was an option for them, or that it was made the norm when it comes to child protection to have a family home visiting nurse in their lives. I do feel they would have been a little more successful. So, little fun fact here, there has been a poll that has been done since 1976, and it's known as the Gallup Honesty and Ethics Poll. And it was created in 1976, but it was never consistently conducted until 1990. And ever since then, nurses have been ranked #1 as the most trusted profession. And so I think that just goes without saying from what we've seen the last few years as well. But we've been ranked #1 for the last 20 years. The only time we were usurped was in 2001, and that was during, of course, 9/11 when firefighters made the top of the list. But even prior to that, nurses were ranked as the #1 profession. So going in with that, what we do in family home visiting is we visit all types of families, not just families in crisis or poor social situations in crisis. We visit all types of families. But specifically for this talk, we'll talk about CPS and how it's going to help these families who are in those situations. We use a Growing Great Kids curriculum, and the goals of that is to growing empathic parenting skills and self-regulation in children, growing parenting skills that support strong social and emotional development, building early language development, supporting cognitive development and learning, building their self-esteem, not only the children but the parents, and growing excellent physical development and health. So the goal too is, of course, building these trusting relationships between parent and child. And we do that through arts and crafts and activities and different modules and educational pieces that we share with families. And this is an evidence-based program, which is very important nowadays, is that it's been proven to work. It's not just someone's idea, it's not just something that was put into place, it's been shown to work. So how can this help families who are in these situations in crisis with CPS? Nurses are very trusted, as we have already stated, and that has been shown. With a nurse, with these families, they can ask these extremely very personal questions. You'll be amazed at the questions I get asked as a nurse. And I think that opens the huge line of communication for families. One thing I think is super important is that as nurses, as family home visitors, we share information with families. We share different tips and parenting skills and ways of approaching their growth and development of their children, how to manage difficult behaviors, things like that. We share it. When families are in CPS, from what I've seen and experienced myself, is they are being told what to do. They have a plan they have to follow. They really don't have a whole lot of choice because they need to meet these requirements for safety of their children, safety of their families. And I like that we as the nurses come in not dictating. We come in and share and give support, which gives, this family their sense of autonomy, which I think is extremely important when they may feel very out of control. We support families emotionally, but we also support them with consistency, which I think is extremely important for families who may be in chaos as well. We show up when we come for schedule our visits. We are always there, usually every 2 weeks, every 1 month, whatever the family wants to go with for their schedule. So we are very consistent. We help families bond and connect with their children. And if you can strengthen that bond between parent and child, that's also going to reduce those chances of child abuse, neglect, and drugs and alcohol. And it makes them have that connection that you need to have between parent and child, not just mother and child, but father and child is extremely important. Our program is voluntary. So when families enroll with us, they know that they can leave at any time. And I think that gives them that sense of security that I don't have to do this. I can choose to do this. We monitor child development and meeting different milestones. And we provide activities also to promote any delay in development. So we do ASQ3s, which are child development assessments, and we do lots of questionnaires and we share. And if a child may be behind, we can help bring activities that will help promote them to help them grow. We also connect families to different services that they may need. And I'm very proud to say nurses, and we are definitely excellent communicators. I'm not going to lie. That's how we're trained. We're trained not only in the medical piece, but communication is key. And as nurses, we are trained to listen, and we have different ways of approaching how we're going to communicate with people that comes off as not threatening. And I find that to be extremely important in these cases. We are trained to not only work with the client or the patient, but nurses work with the entire family. That is our goal. Our focus is the family. Building a closer relationship, of course, between child protection and social workers, the child protection and social workers and public health nurses. And I feel if we can make it the norm for family home visiting and we work closely with child protection, we can serve so many more families. And so I really hope that we can bring that bond closer, and especially with turnover, making sure the new people coming in know that we are there for their families as well. One of the biggest things, though, and I've seen this work in my own families, I feel as though families may be more compliant and more open with CP, knowing that they have a nurse there also to support them. I have been with a family where she had scheduled, social workers coming over, discuss the case, discuss this and that, and she's asked me to attend to sit in as a support person for her. But also she said, I like that you're another ear, you're not part of my family, but you are my nurse who comes in and can help me. Did you hear that this way? What did she say? And I feel like that brings in that extra support for her. And then also, one of the other most important pieces I feel is introducing family home visiting to these families. We can really hopefully stop that familial cycle, that cycle from generation to generation to generation. It's not uncommon, you'll see, where I'm sure you have, Mr. Kleinel, is that you have the mother who now has a child, and she may have grown up with that chaotic household of drugs and alcohol, neglect, or abuse. And also prior to that, grandmother went through the same thing that happened to her mother, which now happens to this mother. So if we can get in there now, we can help stop that cycle right there and show that mom or the father that different route, that different approach that we can help for them to build relationships with their children and help prevent them from being in the case of CP, which of course can lower those incidences. A couple of real quick examples that I do want to give about family home visiting is I had a mom. She has 6 children, and she does not have custody of 5 of them, but she does have custody of the youngest one. And she stuck with me voluntarily even after CP closed with her youngest child. And she was telling me one day that she goes, Shannon, I was talking to my cousin, and I said, you got to get yourself a Shannon. And I said, well, thank you very much. She goes, no, she needs to get herself a Shannon. She needs to get herself a public health nurse because I think she would like it just as much as I do. And I truly took that to heart as quite the compliment that she felt like her family member needed to get it a Shannon. So I thought that was very sweet. Another one is a client to have, she's pregnant, and this is a little bit more of a personal note, but I had come to the home visit, and I asked her, I said, can I please use your bathroom? And she's like, yep, go ahead. So I did, and I came out, and she goes, you were my only worker who's ever asked to use my bathroom. And I said, I'm not your worker, I'm your nurse. And she's like, yeah, you are. It was a different perspective, and I felt like that spoke volumes as well as what we do with public health as our family home visiting. So our nurses here in public health are truly amazing. They really are. They're very good at what they do. And we hope to be able to serve as many families as possible. And I really think making that nice, strong connection with child protection will help lower your incidences of these CP cases and give these families some support and strength in different avenues of how they're going to approach parenting with their children. So thank you.
Thank you very much. Before you leave the podium, I'm going to ask my fellow commissioners if they have any questions for
First of all, can I?
Commissioner Anderson.
I would like to apologize for the coughing spell that I just went through.
Well, you had a nurse or two in the
Just
room.
Dwayne
Yeah.
said further,
We're in good hands.
went down the wrong pipe, so
Trying to kill
go
it.
ahead.
Commissioner Anderson.
Yeah, so my question is, you mentioned that they can opt out of what you're doing, so it's not a court-ordered thing, or is it just an optional thing that's,
It's totally optional.
okay?
And it's available to every single family in Candoa County.
Oh.
Yes, and it is voluntary, so they don't have to.
So it's not is there income threshold where they have to qualify, like if they got to be beneath?
There's different grants and things that we can use to help
Nice.
cover the costs and insurance.
Okay, so if they're over certain, then they pay part of it, okay.
Yeah, we have different grants. We use I believe it's our MCH grant that we have.
Okay, so if somebody wants a Shannon, they can get a Shannon.
They can get a Shannon.
Okay, thank you.
Other comments or questions? Commissioner Gardner.
Thank you, Mr. Chair. I take it then that a lot of the folks that you see are referred to you? Would that be a fair thing to say?
Yes. Yep, we get clients by referral.
Okay. And so those referrals might come from a pediatrician or a family doctor or any number of different.
That's correct. So it can come from doctors, it can come from themselves. They can call us and ask to have a family home visitor. And from CP, it can come from just about anywhere, schools, things like that.
Thank you.
Yeah.
Anyone else? Well, I think it's really helpful to understand the integrated approach that you use with public health as well as with child protection. You made a comment that I think is really significant about the cycle. So those of us who grew up in a culture of strong work ethic, going to church every Sunday, respecting your elders, your parents, that's our normal. That's all we know. But it took generations to keep that normal going. And unfortunately, for those that are in that cycle where it's child and mother and grandmother and sometimes and grandfather and sometimes even beyond that, that's their normal. And it's hard for us to understand their normal versus our normal. So
Yes.
thank you very much.
Thank you.
Well done.
Thank you.
So I'm going to open up my computer again.
Shuts off and wakes up slow.
Yeah. Ms. Kragenbring and Ms. Chavez are going to talk to us about workforce development. I don't know what order. Well, now I know what order, so
Well, good morning.
welcome and thank you
Thanks
for
for having
coming
me.
in.
I don't know, in the essence of time, would you prefer that we come back another time? I'm not sure that we can whip through this in 5 minutes.
We have a grant that we have to do. Should we do the grant today and then save the?
Yeah, if I would suggest, why don't we wait with this workforce development piece? And I think we would have enough time for you just to go over the Healthy Homes Grant and talk about that. Is that
I
skinny?
can.
Does that work for you without the background of what you do? The grant, talking about the grant without talking?
Yeah, well,
Well, you got
presenting
two
on
grants.
different
There's two
grants, the
grants.
Workforce
Yeah, yeah,
Development
yeah.
Grant and the Healthy Home.
Are they
Healthy
time
Housing Grant.
sensitive?
Meaning what? No.
Do we need to get it done now?
Oh,
so
no,
that-
no, no,
okay,
no, no. No,
okay,
it's
very
just
good.
informational
All right,
for you.
all right. So let's, to your suggestion, let's,
Yeah, why don't you just skip through the PowerPoint and just go to the end slides? And just for, we have 10 minutes or so
Yeah.
that we could just do the Healthy Homes and then ask Ms. Chavez to come back. That's a little bit more complicated regarding our data from COVID-19.
Okay. I'm not sure how to put it up there. Oh, you're doing
I
that.
got it.
Thank you. Okay. So we'll just try to do this in a brief amount of time. Again, I think I introduced myself, but I'm going to start over. I'm Denise Kragenbring. I'm a supervisor in public health. So thanks for having me today. So the intention was to give you some detailed information on a couple of new grants that we have in public health. So we're just going to talk about the Healthy Housing Grant today. This is a grant that has been around with the Department of Health for several years. The notice of grant funding comes out every 2 years. And so this past year, we decided it would be something that we would pursue. Anything that we pursue through the Department of Health, we do as a CHB. So this grant is Candoa and Renville together. So we wrote the grant and asked for the money for this program, and we were awarded the grant. The premise of the grant is, you can see this on your slides, for implementing and maintaining primary prevention programs to reduce housing-based health threats, and or providing training on identifying and addressing housing-based health threats, providing technical assistance on implementation of mitigation measures, promoting the adoption of evidence-based practices for mitigation, and developing work practices for addressing specific housing-based threats.
May I
Yep.
stop you for just a second? And maybe I'm premature. What is a housing-based threat?
It is a large parameter of things, from maybe a mold problem to rugs that you're slipping on to
For old guys like
cords
me
that
without
are
a
showing
handrail?
to nobody has a smoke detector, or there's no fire extinguisher. Or, I mean, it's a huge range of
Thank you.
of issues that might be present in a house. So, is this a touch screen? Yeah. Moving on to the next one, the grant funding goes till June, the end of June in 2023. So that's our parameter. We were awarded $90,000 for the 2 years, and that's for the CHB. So partially to Candoa, partially to Renville. There's a wide range of things within the grant that you could ask for. We were focusing on these three scopes of things: the healthy home assessments and interventions, primary prevention, and community education and engagement. So in the next slide, and I'm not going to read through all of that because of time parameters, but that's in those three columns, it explains some of what falls in each of those categories. So I'm just going to give a broad overview of what it is that we're going to do. So in terms of community education, we're going to be out there in the community. A prime example is the expo coming up, the home expo out at the Civic Center, I believe. We're going to have a booth out there with a fair amount of information about this program in the hopes of bringing people in, getting referrals. At this time, I'm going to introduce to you, too. I brought up Carmen McLennan in the back there. Raise your hand. Yeah. She is a public health nurse with us, and she will be carrying out the duties of this grant. She will be the one who's actually going into the home and doing the assessment, giving some suggestions of what type of mitigation needs there might be. So going back to the education, Carmen will be out at the expo giving out information. She's putting together a very, very nice board that shows, what is a healthy home and what are some of the issues in a home that isn't particularly healthy, and what things might there be missing or what changes might need to be. And then we're hoping to get some referrals. She's also going to be working with a number of other community agencies getting our information. We're really early in the grant right now, so we're kind of in the marketing mode, getting the information out there and helping people understand that we will have this service and that it's available in the community. So when it comes to the actual assessment and intervention, what will happen, we'll get referrals from any place. Carmen then will go out to the home. I'm getting ahead of myself because I want to show you what the actual assessment page looks like, but basically doing a walkthrough of every room and looking at all the potential health safety hazards that there might be, and then educating the homeowner or whomever it might be on what those issues might be and what types of mitigations or what kinds of fixes might there be. You really should have this, or you really should move that, and that, the types of things that might be of a concern in that home. So along in that same manner, we will have multiple educational supplies. We intend to put a folder together that we will be able to leave with the homeowner that will have a lot of information about what types of things might be fixes in their particular situation and what they might do. So on the next screen, I know I'm going fast, but who will be offered the services? So there are no parameters on this. There's no income parameter. There's no age parameter. We can serve everybody in Candoa County. We want to focus on those families with small children, particularly those living in poverty. We want to focus on the elderly. We want to focus on some of our racial and ethnic communities. But that doesn't mean that's the only people that we can serve. We just, that is our focus. Again, in Candoa and Renville County. Whoop, I flipped over. So this, it's kind of small, but that will give you an idea of, and I don't know that you can make that bigger or not, but give you an idea of all of the things that we might be looking at in our assessment. It's a very, very full, very lengthy home assessment. Again, I want to say that our focus is primarily on educating. We want to educate the people about what types of changes that they should make in order to make their home as safe as possible. I know that was very short and sweet, but you have questions?
Yeah, curious.
Go ahead.
You talked about homeowners a lot. What if you have a client from Child Protection and you're seeing a client that's renting?
Yep.
Some of these numbers are, and it's only $750 per household, as I read here in one of your.
Yeah, so I didn't,
You're not gonna be able to
when you talk
fix
about the
the-
750, I didn't really go into some of the mitigation supplies. So we do have ability to purchase some things. Say it was a smoke detector, a fire extinguisher, I'm just naming some simple things. If a person can't do that on their own, we have some ability in our grant. We have a dollar amount that we can purchase some of those things. But the other thing that you mentioned was renting.
Yeah.
We absolutely can go into rental places, but we do need to have some permission from the landlord. I mean, obviously, the person living there would need permission for certain mitigation supplies, but there's nothing to say that we can't go into those situations and offer the same suggestions. The changes are the pieces that would need a landlord's
Yeah,
approval.
obviously. Thank you.
So we're going to work together as best we can with other community partners, and we've already started one connection with Red Cross and with our local emergency preparedness folks, where they're already working later this fall. The emergency preparedness folks are be working with the local fire departments on smoke detectors. So we're gonna tag in on that, so we will have an opportunity to be able to get some smoke detectors through the Red Cross at no cost to folks if that's something that they might need as a mitigation supply. So that's just one example of some of the things that we're hoping to reach out to and make this a successful program, and then hopefully we can continue the grant down the road. This is, again, a brand new endeavor for us here in Candoa County.
Commissioner Gardner.
Thank you, Mr. Chair. Just to clarify, is there an action that is being requested of us today, or
There is
this
not.
this came through
Yeah,
CHP?
it's just informational. We've been awarded the grant, and we want to start to get the information out. So if you know of folks that might need an assessment in their home, reach out to Public Health. We are very close to getting out there on our first visits.
I'll have plenty of questions later. We can either take care of those at CHB or some
Sure.
other way offline. But
Sure.
thank you so much.
Thank you. Commissioner Berg.
Thank you, Mr. Chair. Just a comment. Over the years, public health, there's a saying, you've seen one, if you've seen one, you've only seen one. And I think that applies to public health. Different counties have different public health agencies, and they're so different. I'm just so excited, too, of all the collaboration that's taken place with our public health here in Candoa County and in this situation with Renville County as well. I think it's a good way to go, and I'm really proud of all the different things. And over the years, how you've adapted to the different needs of the community, and you're just out there working with everybody. So thank you. Thank you all.
Thank you so much.
Commissioner Anderson.
Yeah, now, this grant, is this renewable, or is it just a one-time?
It is, well, it comes every 2 years. We would
Okay.
have to apply again.
Yeah,
Yes,
okay.
but
Yeah, as
yes.
long as you keep applying it.
It has been a
Theoretically,
long-term,
okay.
continually offered grant, so we'll see. I mean, anything could end at any time, yes, but it's been there a long time, so hopefully it will continue.
Okay.
Thank you. And I don't know this, but as you're talking about these mitigation things, I can't help but think of the family up in the Red River Valley that might have benefited from carbon monoxide detector
Right,
earlier this
right.
winter. So thank you for all this information. With that, I will adjourn the Candoa County Health and Human Services Committee.
I hereby declare the Candoa County Board of Commissioners is now in session. If you will, please stand and say the pledge to the flag with us. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone. I'd like to welcome you all here in your interest in Candoa County government. And the first item on our agenda is the consent agenda. And we have several items in there. One is the minutes. We have the warrants and the claims, and 3 liquor license renewals, as well as a annual gambling permit application. Commissioners, you had all a chance to look at these. Is there any short questions you may have, or any of these items you wish to pull from the consent agenda?
Mr. Chair, I'd move on the consent agenda.
A motion by Commissioner Emdek to move on the consent agenda, and a second by Commissioner Gardner. Any further discussion? Hearing none, I'll call for the vote. All in favor, say aye.
Aye.
Opposed, same sign. Passed unanimously. Now I'd like to call on Public Works Director Mel Odens.
Over here.
There you are. Good morning, Mel. And this is, again, one of your days about the roads, time of that year. And I also see there's several people in the audience very concerned about the bids and here for that. I really want to thank you for coming, and I appreciate very much your putting in bids for these projects. And thank you.
Okay,
Please proceed.
Mr. Chair, members of the board, we do have 4 bid lettings this morning, and incidentally, we will make every effort to recommend a recommendation on award at the end of the meeting. For these 4 bids we're going to open up. We'll just do them in order, and I'll just go from one to the next, if that's okay.
Please proceed.
So the first one is going to be Project CF22, which is our crack filling project. That's 37 miles in the county, and we had 4 bids, and I'll do those in alphabetical order. And we will just be reading the bottom line, no acknowledgements of addendums or bonds or anything. So the first bid is Allied Blacktop Company out of Maple Grove. Their bid is $484,545.22, 484,545.22. The next one is Asphalt Surfacing Corp. Aztec out of, or Aztec, out of St. Cloud, Minnesota. Their bid is $249,065.30, 249,065.3. One? This, okay. We have 5 then. We had 5 bidders. The next one is Farmer Asphalt Sealers out of Wisconsin. Eau Claire, Plover. $339,634.50. 339,634.5. The next one is Midwest Asphalt Maintenance out of Belgrade. Their bid is $267,179.14, 267,179.14. And the last one is Northwest Asphalt and Maintenance out of Thief River Falls. And their bid is $307,935.28, 307,935.28. That concludes the crack filling, the 5 bids. How many do we have of these? And we have, the next one will be, we'll go to the Seal Coat Project, SC-22, and we've got 3 bidders. First one is Allied Blacktop Company out of Maple Grove. Their bid is $658,662.80. 658,662.80. The next one is Aztec Corp. out of St. Cloud, Minnesota. Their bid is $541,346.30. 541,346.30. And the last one is Pearson Brothers Incorporated out of Hanover, Minnesota. $516,578.15. 516,578.15. That includes the seal coat. All right, and how many bidders do we have here? Two. The next will be the 2022 Bituminous surfacing project. This is our 17 miles of Bituminous. We've got two bidders. The first one is Central Specialties out of Alexandria, Minnesota. $5,427,976.14. 542,797.6.14. And the second and last one is Dunnick Incorporated out of Princeburg, Minnesota. Their bid is $4,931,041.33. 4,931,041.33. So that concludes the bituminous surfacing, and now the last one is a project, our SP 34-641-010. It's in conjunction with the city of Wilmer. It's County Road 41. And we have two bidders. The first one is Central Specialties out of Alexandria, Minnesota. Their bid is $754,585.78. 754,585.78. And the last one is Dunnick Incorporated out of Princeburg, Minnesota, and their bid is $677,431.10. 677,431.10. Mr. Chair, that concludes the bids for these four. And once again, we will tally it up, review everything, and our recommendation hopefully will come back for award at the end of the meeting.
Thank you, Mr. Oden. Thank you very much. And thank you again for coming and submitting your bids. At this time, I'd like to call on the Candoa County Feedlot Officer, Mr. Hilbert, for your annual report, is it?
Yes.
Good morning and welcome.
Morning, thank you. I'm just requesting approval and signature on the 2021 County Feedlot Annual Report. The report shows how many inspections were done and types of inspections and any other activities that I did throughout the year that earned performance credits. And the total performance credits was 64.25, and I anticipate we'll still remain maxed out on the amount per credit at $200 per credit yet. So that amount that we receive is a separate performance credit grant that's not required to be matched.
Okay. Any questions or comments from the commissioners?
Russ, maybe want to give an update about the feedlot program that you do for the public who's watching?
For what?
Give an update what your program is, so the public who's watching,
Yeah.
they know what your task is.
So the feedlot program, we're delegated by the state to administer the state feedlot 7020 rules. And I do inspections of feedlots, compliance, complaint, construction, and I handle any of the permitting for feedlots that are under 1,000 animal units and also not considered a large CAFO by EPA definition. And I also do, like land application, complaint inspections, stockpile inspections, and that sort of thing. So, and maintain the registration program for those feedlots as well.
Commissioner Nissen.
Just, are these annual inspections, or?
I try to
as
keep them
needed?
on approximately about a 4-year rotation.
Okay.
And the state in the past few years has asked us to target what they call high priority areas. So in my work plan, I've targeted the Middle Fork and North Fork Crow River watershed because they have a defined border. I think it's in the one watershed, one plan, I think. So I do a few more inspections of feedlots required to register in those 2 townships, and I limit the size of the feedlots that I inspect outside those watersheds to mostly
Yeah.
the larger feedlots and ones
I
that
was
have.
curious about the large dairies and stuff. Do you go there more often, or about the same, or?
About the same. It ends up being about the same. We try to keep everything on a 4-year rotation as much as possible. And
Yeah, thank you.
yep.
Commissioner
Yeah,
Anderson.
I missed, you said there's 64.25 credits, and how much was it per credit?
Last year we were maxed out at $200 a credit. I would anticipate we'll still be maxed out at that.
About 200,
Yep.
okay.
Yep. Our performance credits have gone down in recent years due just to changes on the annual report.
Okay.
Kind of a joint partnership between the MACFO, the feedlot officers, and the MPCA to come up with what we get for performance credits.
Okay.
So every other county's kind of had the same deal too, where theirs is reduced.
Okay,
Number
so
is reduced
when you
too.
say you're maxed out at $200 per credit, is there a maximum dollar amount that you can get then, or
No, if I could certainly,
or is that, okay?
if I was able to get 300 credits, I could certainly do
Okay,
that.
I
you know,
see.
and-
Okay.
and but it's still limited at that $200.
Okay.
But that amount, that pot of money is limited. So if every other county has a lot of credits, then that per credit amount will reduce.
Okay, thank you.
Any other questions or comments? Here,
I would just have one. So maybe I missed it. You don't do feedlots of a certain size, correct?
Right, so if they're over 1,000 animal units, or if they're CAFO by EPA definition, those would still stay MPCA responsibility.
Thank you.
I would only be able to do an inspection if they request me to go out on an inspection.
On their behalf or whatever.
Yeah, yep.
Thank you.
any other comments about how this compared to the previous year?
The performance credit's a little lower than previous year, but I think a lot of other counties are experiencing the same deal.
Okay. Okay. At this point, you need a motion to approve this, am I correct?
Yes,
Yeah,
yep.
approve this report. I'd entertain a motion at this time.
I'll make that motion that we approve this resolution. Let's see here, find out. It's just the 21 feedlot program annual report, I guess, so.
Yes.
I will second.
Motion by Commissioner Anderson, a second by Commissioner Nissen. Any further discussion? Sounds like you've been busy though throughout the year, even with, I suppose COVID doesn't affect you quite as much.
No, but I'm anticipating there's a possibility that high path bird flu may affect things here, so it's getting relatively close, so.
Okay. We have a motion, a second, and I'll call for the vote. All in favor, say aye.
Aye.
Opposed, same sign, passed unanimously. Thank you very much for your update.
I can get a signature on the top here.
Sure, I'll just, you don't need it back right now, do you? What? Okay, just 1 second. I'll just quickly sign this in.
How many chickens can I have before you have to inspect it?
One.
Be a lot, if they're under 5 pounds, is a lot, even if it's over 5 pounds.
Okay.
Okay. There you go. Thank you very much.
I'm looking for eggs.
I got a chicken coop you can buy.
Well, next, I'm going to skip over the next agenda item and go right to Environmental Specialist, Krista Krupa. Good morning.
Good morning.
And
Good
welcome.
morning.
Thank you, Mr. Chair and members of the board. I'm here this morning to ask for a motion to approve 2 resolutions that have come here today. Candoa County has been awarded a $1 million clean partnership loan to aid landowners in upgrading their existing SSTS or septic systems that are failing. The county has been offering this loan program since 2001, loaning over $5.51 million to over 656 different landowners in Candoa County. So I'm here with the resolutions for the loan agreement and the general obligation note. I ask for approval of both resolutions so Candoa County can continue to offer this low-interest loan funding program to our citizens.
So you have,
Mr. Chair, I would move on, first I'd move on resolution 2022-15.
Commissioner Emdek moves on resolution number 2022-15. Do I have a second?
I'll second that.
Second by Commissioner Anderson. Further discussion from anyone?
How many did you have last year?
Last year, we had, sorry, I had my notes. Well, it's a 3-year loan term, so we had 143 loans totaling $1.673 million. We had a $1 million loan extension on our last program, or our last agreement.
Roger's got a question.
Well, that is a very good question.
I think I might,
Commissioner Emdek, proceed.
my question might go into the next resolution, but this is a revolving loan fund, right? As it gets paid back, those funds become available for other loans?
No, so every 3 years, we need to apply for the loan funds.
Ah,
There is an option to ask for additional funding if we exhaust our first million, which is what we did during the last cycle.
and for someone who applies for the loans, the payments can be applied to their property tax, is that correct?
Yes, as a special assessment for 10
Over
years.
10 years.
Yep, at 1%.
Yeah, it's a really easy way, a nice way to finance a fairly significant investment that a lot of people are caught by surprise when
Definitely.
their septic system begins to fail. Or they put their property on the market and discover through an inspection that it doesn't pass.
Exactly. Yep.
It's used quite well, we understand. That's great.
Very. Yeah, it's a good program for the county.
Okay, at this point then, I'll entertain a motion for 2022 Resolution -16.
I think 15.
You got to call the question on the first.
15.
Sorry, 15.
Okay.
You just gotta ask for the vote.
I got to ask for the vote, thank you. I'm just moving through these pretty fast. Okay, we're going to vote on Resolution -15. All in favor, say aye. Aye. Opposed, same sign. Pass unanimously. I think when you mentioned 16.
Yeah, that was my fault. Sorry.
Okay, at this point, I'll entertain a motion for Resolution 2022-16, please.
Also move.
A motion by Commissioner Nissen and a second by
I'll second that.
Commissioner Anderson. Now, any further discussion of that? And the number, is that the number the same? Is that different than for this that utilize the loan? That was a good question, I thought.
This is the general obligation note. So
Okay,
this is actually.
totally a different,
Yep, yeah, it's for the same loan, but this is for, payback and that sort of.
okay, so it is the same then, in
It
a
is, yeah,
sense,
for the 1
or
million.
part of the same package thing. Okay.
Yes.
Any further questions or comments from anyone? Hearing none, I'll call for the vote. All in favor, say aye. Aye. Opposed, same sign. Pass unanimously. Thank you very much,
I will
Krista.
leave this with Tom for signatures.
Okay, thank you. And we are moving ahead at this point, and
Corey's not here.
yeah,
Neither is
I think I'll take a short recess.
Yep.
5-minute recess.
Give them
See everybody's smiling face.
Yes.
Okay, so I sent some materials that I believe are part of your packet for the meeting today. And what we have on tap is a Conservation Partners Legacy grant that Pheasants Forever has acquired. And they wish to use the proceeds to make an addition to a wildlife management area in Candoa County. This would be, I'm just going to round here, so it's 28.94, but we'll just say 29 acres, so.
Can we interrupt you 1 second, Mr. Calando?
If you want to put your map up there,
Sure.
I got it up, so you just center it.
While you're getting that centered, it's always exciting. We're very supportive of Candoa County Pheasants Forever, as well as the DNR working together with them on these projects. That's fantastic.
Thank you, I appreciate that.
Please proceed. Yes.
Yes. Many of you, if not nearly all, I guess, were at a commissioner's habitat tour, I think they called it, or a listening session, kind of a media event, but more of a listening session to bounce ideas off the commissioner last fall. This was ahead of the pheasant opener. I believe it was on the Thursday in advance of the pheasant opener. And we sat down and froze right about here.
And we really did.
Yeah, and so they were already in the works on this, but we were very early in the process and couldn't discuss it at that time. But to the south of the unit, so these are a couple township roads here. Actually, I believe that one might be county, but at any rate, south of the intersection here, or southeast of it, there's 29 acres, and if we can, I think you get the idea from this photo, but there's a continuation of the wetland that's on the north here. There's an equalization culvert there, and that wetland is basically just has a road going through it, but it's part of the same wetland. And then it flows through, and there's some more wet acres over here. Eventually, this creek keeps winding down to which one? Lake Kasota, I believe. So it's in that watershed of the chain of lakes down there at any rate, regardless if it goes to Kasota or Little Candy. I think it's one of the two though. And there are some small fields in here. There's 4.2 acres of cropland on the north, 0.8 on the west. We got another 2.3 in there, and then another 5.7. All total, it's 13 acres of cropland, but it's in 4 very small fields, and then we have 16 acres of wetland there. And it would depend upon the neighbor's drainage as far as the extent of what we could restore the wetlands, and we have not, we don't get into that until after the acquisition in this case, because regardless, if the wetlands need to stay where such as they are, they're worth adding to the wildlife area to, this is 110 acres to the north. It's a little on the small end. So the new criteria for us to acquire a new WMA, the bar keeps getting higher. And right now I've been advised, don't send anything for a new WMA that's 160 acres or less. The exception is when you're adding to a unit. When it's adjacent to it, we already have an investment there and we're adding to that prior investment. So that's the case we have here, is to add almost 30 acres to this 110. And CPL acquisitions, even though this is completed by Pheasants Forever, it's a little different than their Outdoor Heritage Fund grants, where they just do a county notification. In this case, I actually would need a resolution of support for this. And I'm sure somebody out there is wondering about PILT, I'm guessing. So this whole tract, it's 80 acres here, so goes down, excludes a building site, so probably closer to 70. But that whole tract had taxes of $1,240 it's actually 69 acres of cropland. And the PILT for the 29 acres we're purchasing would be $843.75, $843.75. Now,
Well, I'm sorry, Mr.
Okay,
Chair.
okay, yeah, please proceed.
What was the first number that?
Yeah, 1,240.
I didn't think it was 10,000. I have
Yeah.
extra
Okay.
zero in there.
And, just keep in mind that we still have the remaining 40.1 acres of cropland that would still be on the property tax rolls with the private individuals. So that's, I believe that's a strong PILT number if it's well over half of the parcel there, and we're not acquiring half, and the part that we are looking to acquire has most of the non-cropland, has those wetland acres, 16 wetland acres. So I was pleased with how that shook out.
Commissioner Emdek, please.
Yeah, I'm still a little unclear. The 1,240, right?
Yeah.
And what did that tax cover?
So that was
69 acres.
parcel number. I don't know the parcel number, but
So
I'll-
more
I'll-
than the
I'll
20,
sketch it
more
quick.
than the 28 acres.
Yes.
That's all I need to know.
Yeah, and I can sketch it here quickly. It
Because some
goes-
people would wonder if they didn't know that distinction, they'd wonder, why is that a strong built number?
Right, well, it's the 80-acre parcel, but minus the building site, so it's 69 acres here, and that's what so the yellow and the part that I just drew here
Would be the
would be the
1,024.
1,240, and the PILT number is just for this 29 acres, that's the $843.75. So there will be still property taxes on that, let's say, 2/3 or so of that 1,240.
Thank you.
By the time you start doing the math, I mean, that's up to the assessors, but I think it's going to come out well in advance of what the property taxes were.
Thank you for that clarification. And the dollars to purchase this are actually coming from Pheasants Forever, is that correct? Or
In the form of a
combination?
Conservation Partners Legacy Grant, so that's the small grant portion of the OHF funds or the legacy funds that DNR manages those funds, and people put in small grants, and they can be up to $400,000 projects. In this case, we're well below that, but they can be for management activities, so tree removals or seeding projects, wetland restoration, but they also can be for acquisitions. And typically, it's the smaller ones that are not as spendy, so they don't want to go for the big grant option. They just put it in for the small grant one.
And if I missed it, I apologize, but what was the purchase price of this, say, we'll call it 30 acres?
I don't have purchase price, but I can tell you the appraised value was $112,500.
So about 3,000, 30, something.
38 to 87, 35 an acre. Just under 39.
The reason I'm asking that question is that-
3,900, sorry.
I'm sorry. The reason I'm asking that question is some people have the notion that DNR, Pheasants Forever, Ducks Unlimited is competing against farmers for the purchase of land. And you can see this is not the most ideal land for farming, and that's far cry less than what farmland is trading at right now.
Correct. I agree 100%. Land values have increased exponentially in the last, pick your time frame, I guess, but 6 months, 9 months, 12 to a year, they've increased rapidly. So this appraisal is a little bit old because they had some title issues they were working through as well. I don't think it would greatly change because an appraiser must look at the parcel for what it is, so they don't consider that, it would be a different number if we were purchasing the whole tract, but it's just the small fields, and that's one of the reasons I pointed it out is that even an appraisal on the open market, it wouldn't bring, $10,000 per acre if you're looking at fields that are 2 acres, 4 acres, 5 acres.
Nobody wants to monkey with.
It's just carving off the worst of it and retaining the best and continuing to farm that.
Yeah.
Would
Please
beg the
proceed.
question for me why you wouldn't pursue more of those small parcels, because there's more of those available that you can carve off of bigger tracts. But administratively, I know it costs more money per acre to
They're
do that.
about the same price, whether we're buying 200 acres or 2. So, the administrative end of it, it's the same amount of work, title work, all of that. And I guess it's just a matter of what it's also, you know, we need to have a willing landowner or willing seller. In this case, the first offer was we'd like to buy the whole thing. I'll be honest with that. You know, there's some wetland restoration potential here. You can see some wet veins through here. That's appealing to better benefit that watershed downstream as well. He wanted to retain the cropland, but it's still significant enough that we're willing to consider this because we get the majority of the wetland. Now, if we start dicing too much and he maybe only wanted to sell half of it, we're only getting half of the wetlands. There's absolutely no possibility that we can maybe raise water levels a half a foot or something like that. In that case, it probably would not have made the bar for something that I would push forward. We've been tracking that when we get approached for land acquisition. If we turn it down, they want to know this in the New Ulm Regional Office, just for tracking purposes. And we found that about 90% of what people bring to me at the area office gets turned down. So there's a lot more opportunity to acquire lands, but they have to meet a pretty high bar. And in this, the first criteria is it must be close to a WMA or ideally adjacent. You know, and it's getting more and more that case that we must be almost touching an existing wildlife area, or else the other case that I mentioned earlier was we got to have a pretty large tract, 160 acres or larger if we're starting a new WMA that's separate by, you know, more than a half mile or so.
Thank you.
Yeah.
Commissioner Emdick, very good discussion, and thank you for those questions. I was having some of the same questions myself, and it's interesting how everything is so interconnected. But in the bottom line, this looks like a very win-win situation for everybody. Any further questions or comments?
Just, I assume you're going to oversee the crop area into some.
It would be a prairie reconstruction, yes. And we would probably utilize, we've been doing a lot more local harvest of seed. The Nature Conservancy is working with us, so we're combine harvest on the Ordway Prairie and places like that. So we're putting very high diverse seed mixes out here, 70 species up to, well, one that I did recently in Meeker County had 140 different forb species in it. So essentially these cropland areas will be pollinator plots, if you will. You know, they're going to be very good for pollinators as well. The water quality standpoint I've already mentioned, I guess, as far as benefiting the Candoa, Little Candy, Wakanda, Kasota, Minnetonka chain of lakes. That's a good thing. Could use all the help we can give it. An underappreciated resource, in my opinion, in the county. So kind of a neat area. And then, you know, as far as just the land for what it is, this is an outstanding area for pheasants, and plenty of deer out this way too. And, you know, adding a little bit to make this unit be able to support a few more hunters for a few more days is a real good thing in my mind.
Is mine too. At this point, Commissioner Nissen.
I would, if you're ready for a motion,
I was just going to ask for one.
I would move Resolution 2022-14.
A motion by Commissioner Nissen to move on 2022-15, and a second by
I'll second that.
Commissioner Anderson. Any further discussions? If not, I'll call for the vote. All in favor say aye.
Aye.
Opposed, same sign. Passed unanimously. Thank you for coming forward with this.
Thank you very much.
Yes.
You want to sign that for Corey, long as he's here?
Yeah, I think I might have signed it already. Marks might have it. And wait 1 second, and you can take it with you. Karen doesn't need it.
I don't think so.
Okay. Thank you again.
Tom, did you need a copy of that signed?
Yeah.
You want to stop by Karen in the office over there?
Sure.
Thanks, Corey.
Thanks. Good seeing you.
Nice seeing you.
At this point, I would like to call on Candoa County Facility Maintenance Director, Andy Thorson. And you have 3 items you want to ask us to spend some money.
No, yep, finish.
Or pay our bills, right? Pay our bills.
Good morning, Mr. Chairman, members of the board. I'm before
Good morning.
you today to ask for authorization for 3 final payments on 3 separate projects. Project 1 will be the county office building skylight rehab project. And that final payment due is $5,955 out of an original contract of $116,240.
Move on the final payment, Mr. Chair.
Andy, you want, for the public, I also put it on there so you can show the picture? You got a picture of the window? Skylight?
Oh, I submitted that.
I know, but the public can't see.
Oh, yeah, no, I didn't know I needed to bring that. I just
Here.
submitted it on with the files there.
There you go. Mr. Chair. I will second
One
the
second, we got a
motion.
motion, let me announce, we got a motion by Commissioner Emdek.
And I will
a
second
second
this
by
motion.
Commissioner Gardner. Any further questions or comments from anybody? And meantime, Mr. Thorson is trying to show us, and we all have copies here as well. though, but-
Yeah.
You might wanna just-
So the top one you see the before, that's actually with the glass removed, otherwise it wouldn't be quite so clear. They were quite etched up from years of power plant coal dust coming on them. And this is the final project or product. Looks more like little tiny farmhouse windows, I guess what you could call them.
Okay.
They're like a plastic panel, and they're like an inch thick, so the thermal benefits are gonna be quite high.
Okay. Any further questions? If not, I'll call for the vote on approving the final payment for the COB Skylight project. And all in favor, say aye. Aye. Opposed, same sign. Passed unanimously. And now, I believe we got the jail remodel in addition.
Next, I believe on line
you want-
is
jump to
the roof. So we had an original contract sum of $1,079,300 with McDowell Company out of St. Cloud Wake Park. Project turned out fabulous. And the final payment is $53,965. And I know most of you saw what the roof conditions were like before. We had big concrete blocks with rocks that were probably about the size of your fist or larger. And now we went down to a fully adhered asphalt roof. So everything's tarred down. And this is a 30-year roof with, in 30 years, we do a little bit of maintenance on it, and then we get a 50-year roof out of it, 50-year warranty.
Well, I'm really, Mr. Thorson, really glad you brought this forward to us. When we start seeing how with inflation, the costs are going up, and be able to be making the final payment on these.
Yeah.
We saved a lot of money, I believe.
You know, especially with, a roof like this, the main component is asphalt, which is oil. Same with rubber, a large ingredient of rubber is also asphalt. And yeah, those prices are skyrocketing, so I think we got these done in just the right time.
Terrific. Commissioner Gardner.
Thank you, Mr. Chair. At this time, I would move authorization of the final payment on the LEC roof project.
And I will second.
A motion by Commissioner Gardner to approve, and a second by Commissioner Nissen. Any further discussion? Hearing none, I'll call for the vote. All in favor, say aye.
Aye.
Opposed, same sign. Passed unanimously.
And the final contract I bring before you today is making the final payment on the jail remodel and addition. That original contract sum was $2,406,000. We did have some change orders in there, which brought it up to $2,549,502. This last payment due, Brightbot Construction, is $25,495.03.
Any,
Want to show any pictures?
yes, good idea.
No.
No, Mr. Chair, I would move
Okay.
on that final payment.
Okay.
I'll second that.
A motion by Commissioner Emdek, a second by Commissioner Anderson. Any further discussion? If not, I'll call for the vote. All in favor, say aye. Aye. Opposed, same sign. Pass unanimously. Well, thank you very much for bringing this forward.
gentlemen.
And it's good to see these projects come to an end. Big projects and been over a long time.
I just want to say, Mr. Chair,
Proceed.
our facilities plan, and you guys really put this in place. I think our facility committee has worked hard to get our projects up and done. As we talked about in our budget meeting, we have our facilities up to date and good to go for the next 20 to 30 years.
Or we're in
that process.
of.
So we got the courthouse windows that were delayed because of timing and supply. That'll go in this summer or this spring yet. And then, as you know, we talked about the heat pumps. But, you know, by having a plan that you guys have and putting this out has really set the county in a strong financial situation for our facilities and keeping things up to date. And so I just want to thank the facilities team for doing that.
Yeah, on another note, the life expectancy of the water softener, I brought it up to you before, over at the Law Enforcement Center, big, huge monster. Did some engineering on that. Came in about 30% lower than what we were guessing. So the quotes were very competitive, did get 3 quotes. And Chapel Central of Wilmer here, they started a new plumbing division, so I think that's maybe why they were extra aggressive. So they got that quote for $50,000. So it's
Way under.
it was way under what the engineering, what we were figuring on, what the cost was going to be. The other 2 quarters were closer to what the engineer we thought it should come in at, but I'm not afraid of Chapel doing the job good.
Yep, well, that's good news, and we
Yes, it
like
is.
good news.
Always good news to hear.
Yeah, I hate bringing you bad news.
Okay, at this point, thank you again, Mr. Thorson, and I'd like to call on Mr. Mel Odens.
Yeah, Mr. Chair, members of the board, this is pretty quick. We opened bids on County Road 4, just from Lake Lillian North, 2.8 miles on March 1st. We got good bids. We had 3 bids. And it's my recommendation to award the bid to RNG Construction out of Marshall, Minnesota in the amount of $1,475,375.85. That is 1.63% over the estimate, which in this case only amounts to about $24,000, which is, absorbed. And we don't feel that this is going to be a financial impact on our construction budget. So my recommendation would be to award to RNG Construction.
Okay, that sounds like very good news. Also, I'd entertain at this time a motion.
Mr. Chair, I make a motion that we accept bid from RNG Construction.
A motion by Commissioner Anderson and a second by
I'll second that.
Commissioner Emdek. Any further discussion? Hearing none, I'll call for the vote. All in favor, say aye.
Aye.
Opposed, same sign. Passed unanimously. Thank you very much, Mr. Odens. And
I'm going to do this right from here, Mr. Chair.
please proceed, Mr. Kleindall.
So we got a notice from Middle Fork River Watershed District that a manager position term is open. Bruce Schaefer has a 3-year term that will be expiring April 26, 2022. Per Minnesota statute requires county board to advertise for the position for appointment or / reappointment. So I'm asking the board permission to post this and ask for a reappointment or appointment to this position. Persons interested in the appointment to serve as a watershed district manager may submit their names in writing to Candoa County Board of Commissioners Administrator's Office at 2200 23rd Street Northeast, Suite 2020, Wilmer, Minnesota, by noon, April 12th.
And you're requesting a motion?
So move, Mr. Chair.
A motion by Commissioner Emdek.
I'll second
And a
that.
second by Commissioner Nissen. Any further questions or
Yes,
discussion?
Mr. Chair, I have a question.
Please proceed.
I received a phone call this morning from the North Fork that there was a oversight in that they need to send a letter similarly for a manager on the North Fork watershed. Can we do this without receiving the letter from the North Fork Board of Commissioners or Watershed.
That's
Mr.
a
Chair,
question. Please proceed, Mr. Bryan.
just because this is the posting, you're not appointing, I think we can, if the board is willing, I could ask for appointment of advertising for that in the same manner as we're doing today.
Do you
And it's
need a
just-
separate motion for
I
that?
would
or
need a
should I
separate
amend it?
motion and because this is for North Fork.
Okay.
You want to make that motion?
Well, we're in the
let's
middle of
vote
it.
on
I have a motion on the floor.
And just we got a motion by Commissioner Endek, and we had a second by Commissioner Nissen, right?
Yes.
Okay, any further discussion? Hearing none, I'll call for the vote. All in favor, say aye.
Aye.
Opposed, same sign. Pass unanimously. Now, at this point,
Mr. Chair, I would move that we
Give permission?
give the same permission for notice of application for the North Fork of
Fork,
the
for
watershed.
the same-
North Fork of the Crow River watershed.
okay, and is there a second?
I'll second that.
Second by Commissioner Anderson. Any further discussion? County Attorney Baker, you don't see any issue with that, do you?
No.
I didn't think so, but just wanted to check with you as well. If no more further discussion, I'll call for the vote. All in favor, say aye. Aye. Opposed, same sign. Pass unanimously. Thank you. We're coming to the end of the agenda. At this point, Mr. Odens, do you have any final results for
Local
us?
trails too.
Trail.
Pardon me?
You get the trail?
One more.
You gotta know.
Oh,
We're still
Yes.
rolling.
You want the map?
I've got the map here with me if you,
I can put it overhead,
yep.
please.
yes.
Which item are we on now? Is this the DNR grant one?
Yes.
Okay.
Well,
I've been moving around so much.
I know. Should I back it out or are you okay there?
No, I think that would be good right there.
yeah.
So, Mr. Chair, members of the board, every year or every couple of years, there's always grant opportunities from various agencies. And the DNR has been offering grant opportunities for trails for a number of years, and we've utilized their dollars. And so this application is going to be due in April, and we wanted the board to consider if this would be, we have a county road up by the golf course, and if you can see on the map on your screen, there's a gap segment of a little over 3/4 of a mile that goes from Business 71 over to the west edge of the golf course. And last year, the state completed the crossover of the Business 71 connection by the Health and Human Services right out here. So the connection, they took a connection across, made it ADA compatible. So really, the only gap now that we have is from there to the west side of the golf course. So what does that mean? It means that it's going to be a little bit of work because we got to try and get this trail in along the golf course. But on the good part, for the last 3 years, I think, the Lake Association has been pretty active. It hasn't for 2 years now because of the COVID issues, but we were meeting probably every 6 months with the DNR, the Lake Association, the City of Wilmer, which included the mayor and 2 council members. Since 2 years ago, we have not met again, okay? So on one hand, this probably appears like it just came out of the blue. On the other hand, we've been working with this for probably 3 to 4 years. The bike group within the City of Wilmer, this is a gap. And so when these funding opportunities come, we look for money, as you know, every chance we can, because we can deliver these projects. So I don't want you to think that it just all of a sudden came up, because it's been on a map for many years. And it would be a good connection, because if you want to zoom out, Larry, if this connection was made here, you could literally get all the way around the lake, all the way and back on, for the most part, an off-road trail.
Wow.
So it is one of those little missing links that come about. And sometimes that's the only reason that people don't use a system, is because there's a safety issue on part of it, you know? And likewise, the connection across the Business 71 right here by the Health and Human Services. This section on the Midwest Technology Campus from there south was paid for by a DNR grant. When I was at the city, we built that trail that you see there now. That was a DNR grant. So we're hoping that we score pretty well, because this literally would complete the gap to circle both Wilmer and Foot Lake. So it's my recommendation to support the resolution number 22-17 and authorize the chair and the auditor to sign on behalf of the county.
I'll make that.
A motion by Commissioner Nissen, second by
I'll second.
Commissioner Gardner. Any discussions or comments?
Just a
Commissioner
curiosity, if I may.
Just get him.
So,
Then you-
Mel, is that proposed trail, the grant that that is off-road?
Yes, it would be off-road.
Cool.
Yep.
Commissioner Nissen.
Well, if it's off-road, I was going to bring up a point. There's not a lot of room there.
No.
And
Correct that slice and you'll be okay.
yeah, well, it's pretty dangerous when I'm on number 16 tee box, I'll tell you.
Could that be an addendum that?
Are you going to get the land from the golf course side? Because there's a drop-off pretty much. on the
Right,
other
and
side.
so we're gonna meet with the city again, we're gonna meet with the golf course, and then we're gonna verify it all with the DNR. Because with the DNR, okay, so it's, the DNR's goal, and this is a little bit why this got initiated, was they wanna restore the shoreline along here, all the way on this stretch, because of sloughing into the lake. And they wanna restore the shoreline. Well, then they asked me to come to the meeting because they wanna know what the typical section would be if they restored the shoreline. We don't want to revisit this in 5 years and then redo the road and then redo the shoreline again. So they wanted to know where the road would be if they did the shoreline. And likewise, this has been on the trail plan for many years. For the county, probably 20 years. That's why it ended. It ended on hole number 1 or 2, probably.
Yeah.
And so, you know, our goal is to get the trail through there. Well, we need to know what the road's going to do before we do the trail, and so we need to meet with the golf course. So I think if we can all work together, I think we can accomplish it, but it is a little bit of a tight fit
Yes.
for just hole number 10.
I
It's the
have a
tightest
couple
fit.
of trees you could definitely get rid of,
Okay,
because I seem to be hitting them every time.
keep it
I
short.
don't think you're quite, yeah.
So one thing that I did mention, this is a 75-25 grant. And it would have to be built by 2024. So if we're successful to get the money, you're going to see some activity pretty quick.
Okay.
So, I mean, but we got to be successful and get the money, otherwise we wouldn't build the trail. So,
Any further discussion, comments? Mr. Anderson?
Okay, since there's a golf course there, I just had this question. I don't golf, but are these trails, are people able to take golf carts on the trails, or don't you know?
you know, within the city of Wilmer, they don't allow golf carts on trails.
Okay,
I'm not sure that you would be so inclined really to, because this is on the edge on the road.
okay.
And I don't doubt, you know, when somebody's looking for a golf ball, they may go drive on the trail, but as a general rule, you would not drive on this trail.
Okay, because I thought it would be a good fit, you know, if a person could take their golf cart and go up to go golfing. So it just a question.
I truly think that anybody that lives in the country club drive area,
Yeah.
I'm thinking probably will take that short little stretch. You know, and I'll just address it. You know, we did discuss the safety, you know, because not everybody is PGA, but this is not an uncommon thing to have a bike trail next to a golf course. Usually, well, you know, like the fishing by the bridge there's people there all the time. In fact, probably right today, there'll be people fishing. And, you know, that it just seems to coexist. So,
Okay.
Any further questions or comments? I just want to make one comment. It seems to me back when Vision 2020, that this was discussed even then.
Yeah, I
as a
believe it was,
concern.
yeah.
So Yeah, you said, been talked about for 20 years. It really has, and it just kind of shows how maybe little things like that are so important, and finally they do come to a head, and this is exciting to have this. I think so many people in our community have talked over the years that having that option to do that, so you can make those trips, and this fits in. At this point, I'll ask for a motion. Right? No, I got a motion, right? So I'll call for the vote. All in favor, say aye. Aye. Opposed, same sign. Pass unanimously. Thank you.
Mr. Chair,
Please proceed.
the bids are coming in slow,
Oh, okay.
but I don't know if you want to take a 5-minute break.
We can do our report.
We can do our
And
reports.
then we could do that, because
Yes.
I've got 2 of the 4.
Okay.
But we'll come back.
All right. At this point, I'd call on Administrator Kleindahl for any administrative updates.
Just two announcement reminders. April 5th, we will have our public hearing on our redistricting at 10 a.m. in this room. And let's see. And then May 3rd, we start our official board meetings at 9 a.m. Those are 2 announcements and reminders I want to put out there.
It'd be good for the media, for the public to know that.
Yep.
Yes,
Thank you. That's all I
reminders.
have.
Yep. Okay, at this point, I'll ask for committee reports. Or first off, are there any other appointments or anything else you want to put on our calendars? Hearing nothing, I'll ask for committee reports. And I often start down there. Would you mind starting it again?
Sure, no worries. Thank you, Mr. Chair.
Since I always call on you first, and you're always prepared, so please proceed.
Well, thank you for that. Relatively busy week, of course. We spent several days since our last meeting at the AMC Legislative Conference, my first time attending, and that was quite a spectacle, really. First time I'd been at the state capitol since my 6th grade field trip. And I don't remember much of that. So enjoyed being able to visit with our legislators. Took in the meetings for CVB that's today, and Tourism Committee. Candoa County HRA met. And then yesterday was the Vision 2040 Housing Committee that met as well. Several of us took in the Senior Official Emergency Management Training. Central Minnesota Jobs and Training Services Joint Powers Board. We met and conducted some business there as well. And then I was able to go back to one of my favorite things that I've been able to do, not an official thing, but a number of years ago I served on the design team for the Vision 2040 Leadership group, and I was able to help them with their event downtown last Thursday, and centered around having some authentic conversations and experiences around diversity, and meeting with learning more about and meeting with folks from other cultures, and that was held at the library, and that was a great thing. So probably have some more things to talk about in the weeks ahead.
Okay, thank you. Commissioner Nissen.
Okay, well, we had a broadband meeting and had some disappointing news on one of our grant applications that they didn't even notify us that we did not get the grant. They just put a general distribution out of who got the grants. They didn't say who didn't, and that was disappointing. However, we have a interesting proposal from the folks over at Meeker County Co-op to bring broadband into the eastern part of the county, and we're continuing to work on my district. We've got a application in. Well, that's another part of the disappointment is the state has broadband folks have not put together what they require to apply for a grant even yet, so they're pushing everything back. We might even miss this construction year, and that's a sad thing. But on the positive side of things, the federated folks out of Morris are looking at possibly adding 3 more townships to that western band of of people that are not served properly, or sometimes not at all. More to come on that. I went to the legislative conference as well, and done that several times. I thought we had a very good meeting with Andrew Lang. Dave Baker met with us as well, and we were in a room with a kind of a lot of wood, and there was a lot of echoing going on. It was a little hard to get her, but I think Dave got the point, and thanks to a follow-up letter from Jenny on our procurement problem, I think that Dave has really figured it out, and he's having a meeting to get to the bottom of stuff down there. Also, I just attended the senior officials training. I had a real Prime West, as you know, is suing the Department of Health over their procurement process and their failure to follow the law. At least we feel there's a failure to follow the law. The legislative branch passed legislation, and now the executive branch isn't really playing ball. So we had a meeting with the up in Park Rapids. So I had to get up at 5:45 in the morning, drive up to Park Rapids, which is a pretty good haul, about 2 3/4 hours one way, and have for an hour meeting, and then come back home. But they met with their senator up there, the one that represents Itasca County and Hubbard County, and he was very receptive to our issues. In fact, I don't know if he's on the Health and Human Services Board or not. I thought I got an indication that he was, but anyway, he was, and I told him I'd send him the letter that Jenny had sent to Dave, because that really hit the nail on the head. But yeah, it was drifting snow all the way up and all the way back, but not a lot of snow, so my little Ford Focus made it through. Township meeting yesterday, I was there for part of it, and I had to go to a medical appointment. And last night, the Historical Society met, and we're looking at a anniversary Civil War encampment at the fairgrounds in August. So this should be a lot of fun.
Well, thank you, Commissioner Nissen, and also thank you for driving up there and in support of Midwest. I'm the alternate on there, and if you hadn't done it, I probably would have been pressured a little bit. I might have to do that.
Well,
and
my
you
wife had
the
a
knowledge
few
and expertise
kind words
better.
to say to me about how that was very foolish of me, but I signed up for it. And you got to show up for the meetings that you're appointed to.
Well, you're doing an excellent job on that committee, and it is an important committee, so thank you. Commissioner Anderson.
Okay, yep. Since our last board meeting, right after that, we ran down to the St. Paul to go to our AMC conference at the Intercontinental Hotel. And then Wednesday, we all went to the Capitol and met with our representatives and our senator, and which would be Tim Miller, Dave Baker were our representatives, and then Andrew Lang is our senator for our area. And after this year, it switches around to a different district shape or whatever you want to call it. So a couple of them, or one for sure is one. Yeah, one would be leaving. So anyway, but that was interesting as a new commissioner to go down there and talk to them and to kind of represent our area. One thing that was kind of surprising to me was that they said, "Well, we're glad you came, but we don't listen to you guys. We listen to the staff." So good thing we brought our staff too, for department heads. So that way, then we did actually get listened to maybe a little better. So my other meetings, I'm on Environmental Natural Resource Policy Committee. So we did that, and then we just talked about several different issues there. Then last week, Tuesday was the township annual meetings. I attended for Lake Elaine and East Lake Elaine townships. That was just kind of a separate issue. And then that night, we had emergency management supervisor training or whatever at the Emergency Operations Center.
and went to that, which that's very interesting. You find out what you need to declare an emergency and whether or not you're going to get paid back or not, and how you declare it. And you got to be very careful what you say, I found out, because if you say certain things will be put on your tax dollar, then you're going to get denied, probably FEMA money or whatever. So that was kind of interesting. Then last Thursday, I attended a CCT meeting, which is Central Community Transit facility meeting, and there we're kind of discussing what to do with a grant that we're I think we applied for and maybe got or potentially are getting. And
hopefully we're going to
yeah,
apply.
so we're gonna they got to look at upgrading the facility or maybe building a new building for the buses and different things like that.
When will you know that?
Well,
Not really sure.
by the end of April, we should be making
Yeah.
some
Yeah.
decisions for
Yeah.
it. So there is a crunch time.
Yeah, the problem with that is that the grant is probably lower than what a cost of the building will be. So it's a couple years old already, the grant, isn't it? Or
The time frame that, yes.
Yeah,
And
yeah,
the
so-
hopes were that they will add to that grant.
Yeah, so
As time comes up.
that was that. And then yesterday we did met with the Candoa County Township Association, and all of us were there at least for part of it. And that was very interesting, getting updates from our county engineer, Mel Odens, and different people around the county. So that's it for me.
Thank you, Commissioner Anderson. Commissioner Emdack?
Thank you, Mr. Chair. I know it's already been talked about. I'll skip over the EDC Broadband Committee, the township meetings that Dwayne just mentioned, but I'm going to go back to the legislative conference for just a moment. I think it's about as good a one as I've ever attended. And part of it, as Commissioner Anderson said, is that we had our staff do the presenting, and we were pretty well organized as we went into our meetings, and I thought it went well. And by and large, the Association of Minnesota Counties did a nice job, I thought, of organizing. The one that they sent out a survey they'd like you to fill out. And one of the comments I made is that it was a little disappointing that we got back from the Capitol a half hour late for one of the breakout meetings that we wanted to go to. They overlapped. Otherwise, I thought it was an outstanding conference. And then the other thing I did that you guys wouldn't have been involved in, MnDOT is relooking at the safety interchange, or the interchange safety project over at New London, and so that's going to, get started again, and we'll be involved with that. And then finally, just a little bit of a teaser on May 4th, some Minnesota surveyors, county surveyors, are holding a meeting in New London, and as part of their meeting, they're going to go out and do a visit to monuments that were placed in the ground back in the late 1800s, early 1900s, that some of them are being lost. And our county surveyor, Dwayne Bonema, really would like to see county commissioners and people from public works and schools, anybody who has any kind of interest in that type of work surveying, and to try to attend that. And should be an interesting afternoon. That's all I have.
Okay.
More to come on that. May 4th, probably about 1:30 in the afternoon or 1 o'clock.
Well, Commissioner Emdack, thank you for your report, but also thank you for your serving on AMC and your input with AMC and representing our county and our region, and that made a difference, I think. And I agree, it was a very good conference. One person, you could think that, well, we really do have good communication with our local representatives and senators, and we can talk to them about it, but going down there to St. Paul, to the Capitol, does make a difference, and also with our staff, and you have more time, you're more free to discuss things, and it's more timely now to have those kind of meetings. We could have had those meetings earlier, but now there's so many details, and this is a big year, as we all know, when it comes to money and grants and need for services that we maybe will get them funded this time, that we've been begging for years to fund some things. So we'll cross our fingers on many of those things we addressed. A lot of the meetings we all we're at this last 2 weeks. This has been a busy 2 weeks, and I don't know if the public always realize that it's not just this meeting. We are at a lot of meetings together, and I don't want to repeat what everybody else said, other than it's a good educational thing too. And I think education and input go hand in hand as we collaborate with our representatives or any other projects that we work on. That we are at the table, we're talking, and we learn, and we promote Candoa County the very best we can. I really appreciated, so far we got this training for the emergency services and for Candoa County, and the timelines we have to watch for. And it's good to have this background because it's just a matter of time that we will have some kind of emergency, a tornado, you name it, some flooding. Or we've dodged a bullet for a while here, but around us, they haven't. So maybe we're coming due for some needs like that and how it affects all the departments that we have. I had a PAC 4 annual meeting, and I was reelected as the vice chair. And I just want to mention that for the Spirit of Collaboration Award, Commissioner Bob Fox received that nomination and recognized for all his collaboration over the years since 2003. He's been on the PAC 4 board, so he's been involved with PAC 4 for a long time and a real advocate for children and family services. And I just appreciate our relationship with our region. And PAC 4 is really PAC 5. There's 5 counties involved in it, but they didn't want to change the name to 5. So it's good collaboration, good, I guess I can mention the word regionalization of different kinds of services, that we soften our boundary lines and work together and collaborate to get what's best for everyone. I also had an 18-county mental health consortium meeting, and that was in Marshall on Friday, and it was a downer that even though there's all this talk about money available and priority should be mental health, but the funding is not there, and some of these programs are not being funded, and mental health centers especially struggle with finances, and one, not ours as much as another one in this 18-county area was really struggling. We had a discussion about how could they stay afloat, let's put it that way. And the CCT meeting, our community transportation meeting, we had a very good discussion with the other representatives from the other 2 counties that is part of that joint powers, and we got to move on this quickly, so see what happens. We should have some good updates maybe in 2 months on that issue. I guess I am probably basically done and repeating everybody else. So at this point, I'd like to call on Mr. Odens.
Mr. Chair, members of the board, I'll just stay right here. We can award 3 of the 4.
Okay.
That's my recommendation. The first one is the asphalt crack filling project. We would recommend that we award to Aztec in the as-read amount of $249,065.30. The seal coat would be Pearson Brothers, as read, $516,578.15. And then the Bituminous surfacing project would be as read to Dunick Incorporated of $4,931,041.33. It's our recommendation to wait on the County Road 41, the radio station road, because it was 38% over, and we are doing a co-op agreement with the city of Wilmer. And we also have to write a justification report of the overage to state aid. The overage came because mixed prices on that project were about between $88 and $94 a ton, which is a lot higher than the others. So I think we may end up going there because it's a little bit of a complicated project, but we do have to do some more work.
Okay, and you need a motion then?
I would need a motion.
Can I take them?
I'm wondering, do them individually, do the crack filling first.
Sure. Why don't you walk us through that then, please?
So my recommendation is to award, it's Asphalt Surface Technology Corp., or abbreviation Aztec, in the amount of $249,065.30.
I will so move.
A motion by Commissioner Gardner,
Second.
And a second by Commissioner Nissen. Any further discussion? Hearing none, I'll call for the vote. All in favor, say aye.
Aye.
The next one
And
would
those
be,
opposed,
oh, sorry.
same sign. Pass unanimously. Please proceed.
Can I proceed? The next one would be the seal coat project to Pearson Brothers Incorporated for $516,578.15.
Okay, and a motion,
Also move.
a motion by Commissioner Gardner and a second by Commissioner Anderson. Any further discussion? Hearing none, I'll call for the vote. All in favor, say aye. Aye. Opposed, same sign. Pass unanimously.
Then the last one is the 2022 Bituminous surfacing to Dunick Incorporated for $4,931,041.33.
I'll make that motion.
A motion by Commissioner Nissen
I'll second.
and a second by Commissioner Gardner. Any further discussion or comments? Hearing none, I'll call for the vote. All in favor, say aye.
Aye.
Opposed, same sign. Pass unanimously. Thank you, Mr. Odens. This is a concern we had about how the bids will start coming in now with inflation taking place, and I guess we have to
Oil.
hang on and see what happens. Thank you. Any further information or comments from anybody at this point? Hearing none, I'll hereby adjourn the Candoa County Board of Commissioners meeting.